Thanks for joining us today. We are here at Uvalde Family Practice. I'm Dr. Hauptmeier.
I'm Dr. Murillo.
And I'm pharmacist Kristen.
We just wanted to talk to you today about some of the common questions we're getting about the COVID vaccine. We received quite a few, and so we just kind of wanted to debunk some of the fear and hopefully give you some more information. As you know, Dr. Murillo and I deliver babies at Uvalde Memorial Hospital, and so we get a lot of questions from pregnant women. Is this vaccine safe to get before pregnancy, during pregnancy, after I deliver? And the answer to that is a broad yes. It is safe, it is recommended. No matter if you are planning on getting pregnant, if you are currently pregnant, no matter the trimester, and also if you are, if you just delivered and you have a newborn, and or if you are breastfeeding. All of these times it's important to get it. The vaccines teach your cells how to make antibodies against the coronavirus. And so it is not entering the nucleus of your cells, it is not altering your DNA, it is very safe. And so basically, it teaches your body so that your body is prepared with an army of antibodies when you do encounter the virus, because it likely will happen. Another point I want to make is that pregnant women do typically get a lot sicker when they get the COVID infection. So not only are you protecting yourself, but you're also protecting your baby. I just wanted to make sure and touch on that point.
And a question I usually get has to do with fertility. A lot of parents of adolescents are concerned that the vaccines might affect future fertility, and I like to explain that immunity and developing antibodies is completely different from fertilization and in the reproductive organs. So because that big divide, there is no effect of the antibodies from the coronavirus to ever go into or affect anything to do with fertility. Like Dr. Hauptmeier mentioned, it doesn't change DNA, it doesn't affect the function of cells, it only allows it to create antibodies.
And then some of the questions that I've had is, what are the different side effects between the vaccines? And for the most part, they're the same. They all have the common redness, the pain at injection site, sore arm for a few days. Also, we are seeing that if you've had COVID before you've had your vaccine, after your first dose, it seems like you have the side effect of flu symptoms the next day. If you haven't had COVID, then after your second dose is whenever you'll see flu-like symptoms. And that usually lasts for about 24 hours. We've had some rare side effects as far as seizures and other things like that. But those are rare, and they are sometimes attributed to things that are not part of the vaccine.
Dr. Murillo made a really good point earlier, if you don't mind sharing.
Sure. So the way that these vaccines adverse events are recorded is that anyone who experiences any change in their health, whether it is related to the vaccine, whether it is accidental or chronic, if they already have a predisposition to something, they have to report that effect. And what the studies do is they grab all of the different effects that could possibly have happened to the people that they're studying, and they eventually will weed out what could have been attributed to the vaccine and what is naturally occurring or completely unrelated. For instance, if someone were to unfortunately pass away from a vehicle accident, God forbid, that does get that gets reported as a death for if that person was in the study for vaccines. So of course we know that had nothing to do with it, but until all the data has been collected and the statistics are made, it's all kind of lumped together. One of the things that also is attributed to vaccines is things like blood clots. Those are exceedingly rare side effects. However, they do happen in our normal population at random, and what we have seen so far is that in the same small number that happens in the normal population, we are seeing the similar cases in persons who have been vaccinated. The only difference between why we don't really pay attention to our everyday statistics is because we're paying very close attention to the vaccine statistics, and that's why these rare side effects aren't really a part of the overall side effect profile of the vaccine.
And another rare side effect that's been reported is myocarditis, which is inflammation of the heart muscle. There are, on a study I read, about 20 cases, 15 of them were male, 19 of them were admitted, the mean age being 36 years old. The average hospital stay was 2 days, and then when patients were released, none of them were readmitted and none of them died. Of those that did receive the second dose of the vaccine, none of them had any side effects. So I wanted to make sure and mention the myocarditis rare side effect.
Another thing that I'm seeing is, or a question that I've been asked is, my child is under the age of 18. Which vaccine will they be receiving? So as of right now, Pfizer is the only vaccine that is available for 12 to 18 year olds. So that is the vaccine your child will be receiving should they get the vaccine. Just a question, what are you seeing now with this Delta variant? How is it affecting our children?
So unfortunately, our children are getting exposed somewhat in the regular environment that they participate in, but also from the other members of the household that introduce it to them. And what we've seen with Delta, unfortunately, is that patients that are under 18 are getting admitted much more commonly and are having more severe effects from coronavirus Delta variant. This is definitely a big difference from when we first got our wave of coronavirus last year in 2020. So not only is Delta variant much more infectious, it also is affecting our children more often than what we previously saw.
So what do y'all feel is the best way to fight against this Delta variant for those who are under the age of 12 who can't receive a vaccine? Do you feel that maybe family members getting vaccinated could help, or is there any other suggestions y'all have?
Yeah, that definitely goes without saying. I feel like when we vaccinate ourselves, we also help to protect others from getting the COVID infection. So if you aren't vaccinated, it's so important for not only yourself but your family. And also vaccination, the vaccines that are available have also shown to be very protective against the Delta variant. So get vaccinated.
Yes. Some other questions I have are, if I've missed my due date for my second dose, when can I get it? As soon as possible. If you've missed the due date, don't worry about it. Come in, get seen, get your vaccine, and then it's still effective. Third doses, there's a lot of questions about third doses. As of right now, the CDC has recommended that those who are severely immunocompromised are the ones who can get this third dose, and that includes those who have cancer, who are HIV positive, who also have other autoimmune diseases. So looking into the future, they're starting to think that third doses for everybody besides those severe immunocompromised will be 8 months after your second dose. There's no confirmation yet, but that's what it's leaning towards right now.
Essentially, until the majority of the population has either had coronavirus or has been vaccinated, we'll continue to see surges and we'll continue to see high hospital rates, just like we did at the beginning of 2020. Again, we're having crowding in hospitals due to the severe cases of COVID, which is, again, causing us to push our resources to the edge.
Yeah, we're just gonna see it go up and down, and just because we're at a lull and things look fine, we're just gonna keep going back up on that roller coaster. So, what we can do to keep it down is for everyone to get their vaccine.
And just a few more questions I have kind of on the pharmacy side. People ask, how do I get a replacement card? If you lose your card, it is important to go to the facility that you received your vaccine from. That's where you will get supplied a second card. Right now with this increase in COVID cases, also home test is a big question. Those are being sold at your local pharmacies. So that's where you can receive an at-home test. I'm not quite sure what the protocols are as far as outside of that. Do y'all know if they still have the tent set up to get
For testing?
For testing?
Yeah,
Okay.
they are there.
It's by the Civic Center?
Yes, by the Civic Center.
And I believe urgent care also has rapid testing as well. Do you have anything else to add?
If you're not sure where you can get your vaccine or your card, you can go to vaccines.gov. They are keeping up to date real-time count of where you can receive which vaccine. And if you are at all interested or curious or have questions, you can ask your local pharmacist. You can come and ask us, or we'll be happy to answer any of your concerns.
Thanks for joining us today. We hope we've summed up some of your questions and debunked some of your fears.